two neighborhoods in Staten Island, Tottenville, Great Kills, currently New York City's COVID hotspots. Here with an update on the borough's status is the Commissioner of New York City's Department of Health and Mental Hygiene, Dr. Chokshi. Thank you so much for being here this morning, Commissioner. Do appreciate you.
Good morning, Dan.
So let's talk about this. New York City experiencing this uptick in COVID cases. Staten Island currently with the highest infection rate. Throughout most of the pandemic, we know, the borough's infection rate was pretty low there. So how long have the numbers been rising? Is this surprising to you?
Well, we are worried about what we're seeing in parts of the city, including Staten Island, with respect to an increase in cases, as well as an increase in the test positivity rate. This has happened relatively recently, just over the last few days. And it's something that we are encouraging people to take very seriously so that we can try to get it back under control.
When you look at Staten Island in particular, what are you attributing the spike in cases to? Could it just be COVID fatigue?
COVID fatigue is certainly likely to play a role, both in Staten Island as well as elsewhere. We're all tired of the virus, but the virus is certainly not tired of us. But we also knew, heading into the colder months for all respiratory viruses like the coronavirus, that as people move indoors more, as the air becomes drier, it's more likely for that virus to be contagious. So we have to take the steps that we can, particularly wearing a mask and maintaining 6 feet of distance, outdoors and indoors, and avoiding gatherings to help prevent the spread of the virus.
So when you look at specifically the city's COVID positive rate, right, it's around 2.3%, the sixth straight day that we've seen that number above 2%. Are we approaching a second wave, or are we already in a second wave?
The way that I think about it is that 6 feet and a mask is what helps separate us from a second wave of hospitalizations and avoidable suffering. And really what we're trying to do when we see the cases go up, when we see that test positivity rate go up, is to take action swiftly to prevent further spread of the illness. All we have to do is look around the rest of the country, look around the rest of the world. We see much higher numbers elsewhere, but also that cases are followed by hospitalizations and unfortunately deaths as well. And so we have to take action now to try to prevent as much of that as we possibly can.
So going into today, do you anticipate that number to stay at 2.3%? Do you anticipate it going higher? And if it is going higher, and you're talking about the mask wearing and whatnot and kind of preventing these hospitalizations, what steps is the health department taking to prepare for all of this?
Yeah, it's a very good question. And, I think the rate is likely to stay where it is. It may go higher in the coming days as well. And so it's very important, for all of us to take preventive steps. For all New Yorkers, this starts with distancing, mask wearing, as we've already talked about, making sure that you stay home if you're not feeling well, and to wash your hands frequently. Very importantly, we have testing broadly available in New York City. Just go to nyc.gov/COVID test to find a location near you. And we encourage all New Yorkers to get tested, because that helps us to interrupt the spread of the disease.
Good advice there.
With respect to what we're doing as well, the health department, we are making sure that everyone has the information that they need to take those steps. And we're monitoring it both at the citywide level as well as in specific areas.
So looking ahead to the future, we know the holiday season is upon us, right? There's bound to be gatherings and events. People want to be with their family. They've missed their families. What are you urging people to do as they approach Thanksgiving and Christmas, Hanukkah? What do you anticipate as advice or guidance for those folks?
Look, this has been such a tough year, and I certainly understand how what all of us want is some precious time around the holidays with our loved ones. But we have a very clear message, which is that this year's holidays cannot look like last year's holidays. We do want people to be festive, to enjoy things, whether it's putting up holiday decorations or enjoying a meal with your immediate family. But there are some things that have to remain off limits. We're discouraging travel. We also want to make sure that people don't have parties, other, larger gatherings, really anything outside of your own household, because we know, again, during these months, that is likely to worsen the spread of COVID-19.
When you look at it, though, and people don't want to gather then, They're also anticipating what to do in terms of schools, right? Because November 15th is the big day that parents have to decide whether to go all remote learning or send their child back to school. They have to decide. Looking at the numbers, they're anxious about making that decision, knowing it's for the remainder of their school year. What's your advice for parents, and do you anticipate schools actually shutting down?
Well, as a parent, I really empathize with those concerns. You want your child to get the best education possible, and we have an amazing school system here in New York City. What I would advise parents is that we have the safest school health and safety standards in the entire country, with respect to everything that we've done to keep schools safe, to make sure that both staff as well as students are protected, to keep people who do have the infection home and not in the school environment. And that's borne out by the testing numbers that we're seeing in schools. Mm-hmm. So I would encourage parents, it is an individual decision,
right.
But my strong message to everyone would be that schools are safe. We have to keep an eye on the numbers, but we have a good plan in place right now.
Hey, I see you still got your flu button pin on. Flu season is upon us. I see a lot of people getting their flu shots too. A lot of long lines for both the flu shot and now coronavirus testing at some of these city MDs and urgent care centers around the city. So people are trying to stay safe. Commissioner, I do appreciate your time this morning and for coming on to talk to us about this. It's a very important topic as we head into the holidays. You are welcome back anytime, sir.
Thank you for having me.
All right.